Welcome to the Advanced Oral Health and Life Coach Certification. Today we're going to be discussing illness-specific health coaching certification, more specifically regarding the asthma and respiratory health. Introduction. Asthma and respiratory health are critical areas in focus of personal wellness, yet often remain misunderstood or underaddressed in many health coaching practices. Asthma is a chronic respiratory condition marked by inflammation and narrowing of the airways, leading to symptoms such as wheezing, shortness of breath, chest tightness, and coughing. Affecting both children and adults, it is a pervasive condition with environmental, genetic, and lifestyle-related triggers. Asthma significantly reduces the quality of life, limits physical activity, and if unmanaged can escalate to life-threatening respiratory distress. Key points. Understanding the pathophysiology of asthma. Asthma is a complex condition with intrinsic pathophysiology. Health coaches must always understand the core principles to develop informed choices. Airway hyperresponsiveness. Due to an overreaction of the airways to triggers such as allergies, cold air, or pollutants, asthma occurs. The airway smooth muscles constrict, leading to characteristic narrowing seen in the asthma attacks. Chronic inflammation. Persistent inflammation within the bronchial tubes results in swelling and increased mucus production. Over time, inflammation can thicken the airway walls, reducing the airflow even when the client isn't actively experiencing symptoms. Asthma triggers. These widely vary because each individuals have different types of symptoms, but the most common ones are pollen, dust mites, mold, air pollution, stress, exercise, and tobacco smoke. Identifying each client's specific triggers is essential for effective coaching. Disease classification. The severity of the asthma is categorized into intermittent, mild persistent, moderate persistent, and severe persistent levels. Coaches should be tailoring their guidance based on whether a client's asthma falls on this spectrum. Developing asthma action plans for clients. A personalized action plan is a critical tool in asthma management. Coaches can guide the clients in collaborating with their healthcare provider to create a comprehensive app and execute it effectively. Components of the asthma action plans: daily medication management, recognizing warning signs, trigger avoidance strategies, emergency responses. Role of the coach. You need to be ensuring that the clients fully understand, adhere to, and remain confident in their action plan. Regular check-ins can ensure the plan remains functional and up-to-date as the client's condition evolves. Promoting breathing techniques and exercise for respiratory function. Breathing exercises are immensely beneficial for asthma and overall respiratory health and can be integrated into coaching sessions. They include teaching diaphragmatic breathing, pursed lip breathing, pranayama yoga breathing, and respiratory muscle training. Dedicating a few minutes of each session to teach a breathing exercise can encourage the clients to implement these and as daily habits or use them during stressful situations to improve airflow and relaxation. 4. Lifestyle strategies for asthma and respiratory management. Nutrition. A diet rich in antioxidants, omega-3 fatty acids, vitamin C and E can reduce inflammation in the lungs. Example foods like salmon, spinach, citrus fruits, and nuts. For clients prone to food allergies that exacerbate symptoms, a tailored elimination diet may reduce the triggers. Air quality management. Recommendations include eliminating smoke exposure, using HEPA filters, and maintaining humidity levels between 30 to 50%. Take a moment to have a look at the diagram on the right, which looks at the more factors which contribute to this. Physical activity. Sometimes high-intensity exercise can trigger asthma, so activities like swimming, yoga, and brisk walking can improve lung capacity and cardiovascular health without undue respiratory strain. Coaches can educate the clients to warm up thoroughly and recognize the safe threshold for exertion. Stress management techniques. As the stress can trigger asthma symptoms, practices like mindfulness, meditation, and 4-7-8 breathing can help the clients gain control over their stress responses, because stress responses also occur due to cortisol levels which are on the heightened side. Example, develop a whole health plan that includes nutrition, exercise, and stress management tailored to the client's symptoms and lifestyle. Advanced insights into asthma and respiratory health. For enhancing the coaching practices, these are some advanced strategies to know. The gut-lung axis. The research emerging highlights that the gut microbiome influence on lung health is important, so encourage probiotics and prebiotic fiber to support immunity. Medical device education. Make sure that your clients are proficient in using medical devices like inhalers, peak flow meters, and spacers, improved for managing the symptoms and lung function. Behavioral psychology in coaching. As the clients experience asthma stigma and may feel self-conscious using inhalers in public, you should be acknowledging the condition, and the coaches should be validating these emotions while reshaping their belief systems to foster self-acceptance. Adaptability planning. As asthma is non-static, it changes with age, season, and lifestyle. Coaches should be remaining flexible and regularly discuss action plans with the clients to ensure they're always prepared. Best practices for coaches. While coaching clients on asthma management and improving respiratory health, it is vital to follow evidence-based strategies that holistically addresses their needs. This section outlines the best practices. 1. Educate the clients on asthma fundamentals. It matters as the solid understanding empowers the clients to identify the triggers and better adhere to the action plans and effectively manage symptoms. Action steps is simplifying complex medical information, using visual aids to explain the pathophysiology of asthma, and reinforcing how other factors like weather and pollution can influence the symptoms. 2. Create a tailored, personalized action asthma plan. Individualized strategies improve adherence and responsiveness to symptoms or attacks. Components include incorporating prevention methods, trigger avoidance techniques, and emergency response protocols. Adjust plans seasonally or based on the life circumstances, and collaborating with healthcare providers to ensure medical advice aligns with the client's goals. Example scenario: finding solutions for clients with seasonal allergies by recommending solutions like the HEPA filters or masks or high pollen days. Introduce breathing techniques to clients. Key exercises can be including diaphragmatic breathing, pursed lip breathing, and AHNCO breathing. Coach's role is to dedicate time to teaching and practicing these techniques with the clients and reinforcing daily use for long-term respiratory benefits. 4. Encourage stress management practices. This is because the mind-body connection plays a big role in asthma. Stress often worsens them. Strategies you can use is teaching mindfulness exercises like meditation, suggesting building calming pre-bedtime routine for better sleep quality, and promoting gratitude journaling to shift perspective from limitations to accomplishments. Focusing on nutrition and hydration. Tips including anti-inflammatory foods like salmon and berries, addressing food allergies, and recommending gut meal-friendly options like fermented foods. Coach's tip: help the client's meal plan and maintain hydration habits to keep the mucus thinned for easier breathing. Monitor and guide the physical activity. Physical activity strengthens the lung function but must be approached carefully to avoid triggers. Example: swimming, brisk walking, and yoga. And to advance, you can gradually increase the intensity while tracking the asthma responses. 7. Establish a proactive air quality plan. Environmental pollutants like pollen and dust can worsen asthma symptoms. So, to remove this factor and implement them, you can distribute resources for monitoring daily pollution levels via apps or wearables and teach simple preventive measures like HEPA filters. 8. Strengthen the mindset with behavioral psychology techniques. Clients may feel embarrassed or stigmatized by asthma, so the coaches must be validating their feelings. You can build the client's confidence using motivation interviewing technique, redefine a client's value of asthma from a barrier to a manageable aspect of their lifestyle. 9. Integrating technology with asthma care. Explore how the digital apps or wearable devices can monitor the air quality. Example: smart inhalers can track the medications and usage. Coach's role is to train the clients on selecting and using relevant technology. 10. Advocate for continuous improvement and check-ins. As health isn't static, action plans and strategies require updates as the clients evolve. An implementation plan could be scheduling regular reviews of action plans and health goals and encouraging the clients to record symptoms and triggers using journals. Leveraging group coaching for community support. Group coaching can reduce isolation, provide accountability, and offer shared coping strategies. Coach's role is to facilitate asthma education workshops or online forums. 12. Advanced knowledge for comprehensive care. As gut health impacts inflammation and immunity, recommend probiotic-rich foods. Make sure that you're guiding proper usage of devices, example peak flow meters, and prepare for varying conditions like high stress or seasonal spikes to maintain symptom control. Let's have a look at some of the summary tables. Table number 1 looks at the pathophysiology of asthma. Let's look at chronic inflammation as one of the aspects. Description: ongoing inflammation causing swelling and mucus buildup in the bronchi. Example: thickened airway walls in the clients with frequent attacks. Significance is that reduced airflow even without active symptoms. Coach's role is to encourage practices like reducing inflammation and diet changes. Take a moment to have a look at the rest of the table. Table number 2 looks at components of an asthma action plan. Let's have a look at early warning signs as one of the component. Definition is a recognition of symptom changes. Example, increased wheezing or nighttime coughing. Purpose, it helps prevent full-blown attacks, and coach's role is to review the clients to act early on signs. Table number 3 looks at the breathing exercises for asthma. Let's have a look at pursed lip breathing as one of the exercises. Technique, slow exhalation through the pursed lips after deep inhale. Benefit, keeps the airway open longer and reduces shortness of breath. When to use, during mild asthma symptoms. Coach's strategies, role-playing during sessions, recommended for symptom onset. Table number 4 looks at the lifestyle strategies for respiratory health. Let's have a look at physical activity as one of the strategies. Description, activities that boost the lung capacity without triggering asthma. Example, swimming, yoga or walking. Impact, strengthens the respiratory and cardiovascular systems. Coach's guidelines, encourage low-intensity exercises with proper rep and prep. Lastly, table number 5 looks at the advanced insights for asthma coaching. Let's have a look at gut-lung axis. Explanation, it highlights the link between the gut microbiota and the lung health. Relevance, probiotics support immunity, reducing inflammation, and applications including yogurt or kefir in the client's diets. Supporting the client is explain how the microbiome is important and suggest small changes. Let's have a look at some MCQs. Take a moment to have a look at question number 1 and 2 without seeing the actual answer. Take a moment to have a look at question number 3 and 4. And finally question number 5. Thank you.